COVID times are tough times, especially for the health personnel who are on the field doing lot of work in these troubled times. One of them is Dr. Jorson from Cuncolim. He is a very busy man. In spite of that, he took off his time to answer a few questions on COVID-19 related. He has been conducting a lot of awareness programs and for the health workers, starting from the Cuncolim municipal workers to all over Goa. He has been also reaching out to the masses and educating people on the COVID-19 symptoms and how you can get transmitted and how to protect yourself. Over to Dr. Jorson.
Yeah. What we have decided now is a couple of people from Cuncolim got together. We had a Zoom meeting just about a week back, and we have decided that we are going to launch our health education program. We have already devised the whole PowerPoint presentation in English, but we are going to tap people who can talk to them in the language that they understand. So we are tagging it through our Rotary, because our Rotary extends right up to Karnataka, parts of Andhra Pradesh, Maharashtra. So whoever wants it in Telugu, whoever wants it in Oriya, whoever wants it in Kannada, we will tap our Rotarians, we will tap our Red Crosses or St. John Ambulance people who are able to translate this into their language. We have made our videos, the Cuncolim Art and Cultural Association. All their members got together and we did a video. You must be knowing the nursery rhyme, Ringa Ringa Roses, pocket full of posies, ashes, ashes all fall down. We have changed that a little bit. When we are doing the Ringa Ringa Roses, instead of holding hands, to show social distancing, we have spread our hands, horizontal to the ground of both the people so that they are not touching one another. That means we are showing that you must maintain this distance of almost about a meter from person to person. And when we are talking about ashes, where we are going to sneeze and cough into the crook of the elbow. These songs are being enacted by a Cuncolim Art and Cultural Association. We did those videos. We did videos on hand washing with the Cuncolim Art and Cultural Association. And believe me, Armstrong, we put them up after showing it to the DMA. The DMA decided to share that with all the municipal workers so that they understand how to wash their hands. So this type of health education program is what we want to do for all the people, whether they are migrant laborers, whether they are our own people from Goa, or whether they are anybody else. So we are targeting the schools, higher secondaries, colleges, as well as we are targeting all these industries. We want to work with them. We do not want to antagonize them. We want to work with them and tell them, yes, here we are to help our own people. You do your livelihood, but at the same time, take care of our lives and your lives too. Even now, we are doing our firm efforts. We have already tagged into our schools over here. I think probably another 4 or 5 days, we are starting with our health education on COVID-19 for our schools. We are starting with Infant Jesus High School, then Our Lady of Health, then we are going to Maria Pamina's, Cuncolim Educational Society. That is the whole higher secondary, high school, and the college. We are going ahead with everybody. And then afterwards, we are tapping even Shishini, Veli, and our St. Anthony's in Baroda also. And possibly we are going to take the government high schools in Barli, Fatarpa, all those places. And then we are going to go to the industrial estate in between after 5 o'clock. So when they finish up their job and they come in, we will be taking that. We want the industries to put up a television for them on a screen. They can see everything that we are speaking. And if they have got questions, then they can ask them in Telugu or Kannada. And then we will have people onto our board who will be answering those questions for them.
Good initiative.
Now, the pigeons that have died in the IDC office is being unused. The toilets are in very bad shape. There is all pigeon sheet all around the place. They're not being managed at all and not being cleaned up for the last several years. Why have the pigeons died? That is my concern. I'm not averse of they starting a COVID care center there. You can start a COVID care center, but then you must see who are the healthcare professionals who are going to work there. Because there are no healthcare professionals at the moment to run the GMC because we are short-staffed, and at the same time to run the COVID-19 center. And you are going to start another COVID-19 center. So when you are starting another one, you need more healthcare professionals. So there would be volunteers who are going to work down there, or there you have to tap some private practitioners who are going to work down there, or you have to see that you are going to recruit some more people who are going to work down there. But the center that we are going to have, where the pigeons have died, we must realize and find out why these pigeons have died. There should be an assessment that should be done by the Pollution Control Board. Pigeons are flying everywhere, but we don't see pigeons dying unless until they are hit by some aircraft, or they are being hit by somebody, or they are being shot by an air gun. But these pigeons dying into those rooms, there is some message that is being given to us that there is some pollutant which has affected these pigeons. So is it the water that they have been drinking around that has caused this? Or is it the airborne pollution that has caused the death of these pigeons? we have to find these things. And the only authority that can find out these things is the Pollution Control Board. They have to come back again for reassessment of the water and the air. And accordingly, they could decide. Otherwise, what will happen is tomorrow when we start putting the patient will be lost, because they will develop comorbid conditions over there only because of pollutants that are coming from the industry. And that should not happen. That is my concern, not anything else. The center is okay, everything is fine. But if the pigeons have died, it is sending you a signal that yes, everything is not fine over here. Let us find out why these pigeons have died. And accordingly, let us work out if we can take care of that and then open up the COVID-19 center there.